The purpose of this video is to increase the knowledge about oral manifestations associated with diabetes mellitus. So what is diabetes mellitus? It's a chronic metabolic disease characterized by hyperglycemia due to either a deficiency of insulin secretion or resistance to the action of insulin or both. In this video, we are going to briefly see about some oral manifestations of diabetes mellitus. Let's see about xerostomia. People with diabetes experience salivary dysfunction, which can lead to decreased salivary flow and change in saliva composition. Xerostomia can lead to numerous problems such as difficulty in eating, swallowing, and speaking. It can actually have a negative effect on patients' quality of life. Next, dental caries. Diabetic patients are susceptible to the development of new and recurrent dental caries due to reduced cleansing and buffering capacity of the saliva, increased carbohydrates in the saliva, and increased level of oral yeasts and streptococci mutans and lactobacilli, which can lead to the incidence of tooth decay.
Next, periodontal disease. Poor glycemic control can be associated with the outbreak and progression of gingivitis, periodontitis, and alveolar bone loss due to the increased susceptibility to periodontal diseases include alterations in the host defense response, subgingival microflora, structure and metabolism of collagen, vascularity and gingival crevicular fluid, and also inheritance patterns. Next, oral infections. Patients with diabetes are more susceptible to the development of various oral infections including fungal and bacterial infections. Decreased salivary flow rate and the absence of its antimicrobial effects can cause these infections. In addition, an impaired defense mechanism and poor metabolic control may play an important role in developing infection.
Next, burning sensation or dysesthesia in the oral cavity of diabetic patients is attributed to poor glycemic control, metabolic alterations in oral mucosa, angiopathy, candida infection, and neuropathy. Neuropathic pain in these patients can be manifested as burning, tingling, or even as electric shock or stabbing sensations. Next, taste dysfunction. Taste dysfunction can occur in patients with poorly controlled diabetes. This sensory dysfunction can inhibit the ability to maintain a good diet and can lead to poor glucose regulation. Next, oral mucosa alterations. Some oral mucosa alterations such as coated and fissured tongue, geographic tongue, recurrent aphthous stomatitis, and some pre-malignant lesions including lichen planus can be associated with diabetes.
Next, poor oral wound healing. Delayed healing of the soft and hard tissues in diabetic patients is a well-known complication during oral surgeries. It is due to the delayed vascularization, diminished blood flow and hypoxia, and a reduction in the innate immunity, decreased growth factor production, and psychological stress. Next, silent adenosis. It is a rare, non-inflammatory, non-neoplastic enlargement of the major salivary glands, usually bilateral and often painless. It is often associated with diabetes mellitus. So finally, oral complications in patients with diabetes mellitus are considered major complications of the disease and can reduce the patient's quality of life. Thus, prevention and management of the oral complications due to diabetes are considerable.